Welcome back. We've been joined and still in our Abuja studio by Dr. Ibrahim Adamu, Director of Public Health, Nasarawa State. Thank you, Dr. Adamu. So let me put this question to you. Your state was one of those mentioned by in that briefing by the Minister of Health. And before you came in, Dr. Onoka was talking about the reactions of Nigerians, maybe because of the pictures they saw out there. Can you tell us what's going on in Nasarawa?
Well, thank you for having me. Yes, my state was mentioned by the Honorable Minister as part of the states that have recorded suspected case of monkeypox. And we're still awaiting the results of the sample we sent to the public health here in Yaba. Right now, everything is calm among the population because we addressed a press conference to allay the fears of people. We have also commenced sensitization activities in the media. We've made radio and television jingles that are being aired currently. We have also planned to do a community sensitization, piggybacking on the large spread of the National Orientation Agency staff at the communities at our local government, because we know that these diseases will, because of the rural nature of these diseases, they will likely be more common among communities. So we want to go down to the grassroots so that we can be able to conscientize people and sensitize them to let them know what this disease is about and how we can prevent ourselves from getting this disease. Having also done that, we're also planning to also do another sensitization among the health workers so that they can have very high index of suspicion. Any fever with rash should raise a red flag, and then they should invite the rapid response team, which is also all the time ready to deploy to the affected site for the appropriate actions to be taken.
Now, Dr. Adamu, don't you think that we're being rather reactive? Because the monkeypox is a viral zoonosis transmitted from animals to humans, which is the same as Ebola. So wouldn't you have thought that after Ebola, that we would have learned our lesson and that the campaign, the awareness campaign, should have been ongoing so that this wouldn't even have occurred at all in the first place?
Well, I agree with you that we should have sustained the awareness campaign all through since the advent of Ebola. We are doing that, particularly in Nasarawa State, only that it's not on a large scale. And this is a good wake-up call for us to intensify our sensitization and keep it on, because we know that the preventive measures are quite similar. And if we can continue advocating for improving personal hygiene, improve hand washing, avoidance of contact with animals, then it will go a long way in preventing this occurrence or spread of this disease. But let us also not lose sight of the fact that some of these viral diseases are emerging and re-emerging. Monkeypox, this is not the first time monkeypox is appearing in Nigeria. In the 70s, a case of monkeypox was recorded in this country. So we have what, as it were, some level of institutional memory. And going forward, I agree absolutely that we should continue our intensive sensitization and campaign at all levels, from community up to the cities.
All right, Dr. Onoka, yeah. Dr. Adamu mentioned something that he said we have some level of institutional memory. But how much of institutional preparedness is there? Because we now see that this news of monkeypox is affecting things that are, what do you call it, immunization processes that have been established, I mean, for polio and all of that. So now parents are not even allowing their children in some parts of the country to be part of the vaccination processes that are going on because of the fear of monkeypox. So how prepared are the institutions?
Well, as you may know, the federal government has been working on strengthening the various aspects in terms of response, and I think that's why, like, the NCDC has come up very strongly, and there's a lot of effort to make sure that that works very well. You may also know that we have, like, a polio emergency operating center and a polio center, and that leads the response in terms of polio. All of that has been generating a lot of lessons that are needed to institutionalize the responses that we have, just like the Ebola thing. And like I mentioned earlier, we have the person that managed the Ebola outbreak response, who now leads the National Primary Healthcare Development Agency, and is bringing a lot of that knowledge into the system to see that things are framed very well based on the things that were learned. Now, that's from the government side. That's from the public space. You also have the part that all the other institutions really need to, the roles that they need to play, from the media to the educational institutions and all that, which is transmission of the risks, the information on risks. That awareness creation is something that, we all share collective responsibility to sustain. That these things can happen, and we need to keep the information that has come out there. We need to keep it going, and we need to sustain it. Whatever happens, whatever else is going on in the country, we need to keep that information going. We have people, for instance, working with the states. We have people down at the grassroots level, at the communities, in the villages, in every ward in this country, who provide such information. And then, the agency has also been leading the movement to strengthen that level of defense. And with the community health influencers, promoters, and services program that is going on. Now, we're connecting all of that to see that even from the center and at the state levels, information can always go down straight away. And then strengthening the way that we get information from there, the surveillance and notification systems, that when there's anything that people pick up, they can easily transmit it, and we get information at all of those levels, the LGA, the state, and the national level, so that we can respond rapidly. So that is going on, and really something that we all need to do is to sustain the right information among citizens. And that's something that from the professional groups to the private sector, and then going to our churches, our traditional institutions, we need to have that information given out to people. There are people that just call health workers at any time. We know how people do that a lot. And all of us need to keep that information outside. So it's in all of those areas that there has been a lot of effort to make sure that those things happen, just like you asked. Yeah.
Now, Dr. Adamu, the huge scare that there was in the course of this week that caused parents to withdraw their children from schools. Now, how should we handle that so that parents begin to allow their children to take advantage of these various immunization programs?
Thank you very much, Lero. You notice that the minister also mentioned things about that. You notice that the minister mentioned things about that. And yes, it happened. The military had the activity that they carried out. And they are not new things. But the important thing to pay attention to is that immunization is something that is of value to us. Immunization is something that if a family is blessed with a child, they can do everything possible to keep that child to have a chance to life. And lots of people, even though we receive it free, a lot of people are paying for it. So it's not costless. It's a lot of money to produce. It's a lot of money to transport it down here. And then the logistics of moving it from the ports when we receive it through the stores to the child that needs it. it's a lot of money. And the vaccines is of value. Somebody said something to me and was like, I don't even have, I need to give consent and all of that. I said, fine. Just remember that you're living in Nigeria. You're not living abroad. Here, you have a lot of exposure to infective organisms. And the best thing to do to this your child that you prayed for, God gave you, and that you want to have a chance to life, is to protect the child from day zero. And you must disconnect it from political, religious, ethnic, regional sentiments. It's your child. These are our children, and we must protect them. And if we have that understanding, if we have that information, then we're going to disconnect it from even the events that happened. I wouldn't wait for somebody to come and say, for a child that I took time and my wife carried for 9 months, for somebody to just wake up and tell me that, look, I shouldn't take vaccines. I should be wise enough to say, no, it's not like that. It shouldn't be. So let's disconnect it very much, from what happened. And let's say, look, we need to get our people wherever